Hello people, so in this video let us look at how to read pathology. Okay, so basically pathology we have already finished 2 videos, right, where we have told you what textbooks to read, what the syllabus is, etc. Now this is a very generic video as to how to read pathology, how to approach the subject, how to pass mainly. Okay, so basically as every subject we tell the same thing, go to the question bank of your university, look at the priority questions and focus more on the priority questions. Okay, and then so basically in pathology, again in the exam you may have paper 1, paper 2, which is dividing the pathology into parts, right? So some parts like general pathology could be in one, and in systemic pathology some parts of it can be in paper 2, etc. So you will have 2 theory papers, right? And you will have practical exams also. Now let us say general pathology, how to read. Now general pathology, neoplasia is very important chapter, okay? Basic concepts about these you should know. Like what exactly, which word comes where. Everything has specific words, okay, in pathology. Now let us say, let us go to some systemic pathology. Let us say the kidney, right, the kidney. What will you see in renal cell carcinoma? Let us say. So you should know upper pole of the kidney, upper pole of kidney. Specific things will be there, no, for renal cell carcinoma. The upper pole of kidney is affected. You will see clear cells, right? That's why it is called as clear cell carcinoma. Specific words you should know. So you write those words, you know, those, don't read everything. The specific words you highlight and go on reading. Where when you see, some things you will see in only one place. Like let us say comedonecrosis. Where will you see comedonecrosis? In the breast, right? So comedonecrosis you will see in the breast. So those specific words you should be writing and keeping. Like let us see this one. See, comedonecrosis breast. Which one? Infiltrating duct carcinoma of breast. So specific words you should focus on. 2 words about each of these diseases, 2 words that you see in pathology. In the gross, what will you see? In the microscopy, what will you see? So in the gross, you will see hard irregular mass, right? Then you will see cuts with grating sound, chalky streaks. These are specific words that you will have to write for infiltrating ductal carcinoma in the gross. In the microscopy, comedonecrosis, right? All these standard one specific terms you should know, okay? And always focus on the priority questions. So you can't read everything. Now, when it comes to practical, let's go to practical now. Let us say the histology, right? The slides. Now, let us say in slides, basically you have to identify the slide, right? So actinomycosis, purple, very easy. It's nothing but sulfur, right? Sulfur granules, right? What do you think this is? Easy. Osteoclastoma, look at the giant cells, right? So basically, it is not so difficult if you keep practicing and learn specific points. About osteoclastoma, 2 points. Gross 2 points you say. Then you say microscopy 2 points, right? Osteoclastoma, what will you say in gross? A soap bubble-like appearance in radiology, honeycomb appearance in gross. Then it will affect what? It will affect the epiphysis. In microscopy, what will you say? This giant cells, etc. See, this is giant cell, right? This is the epiphysis, honeycomb appearance, hemorrhage, necrosis. What else should you know? Hematology, they will give you a patient's blood, and the patient's blood you will have to do the blood grouping. Blood grouping is not difficult, that's what it feels, but I landed up messing up my blood grouping in my exam. So remember, when you do blood grouping, you should look for, just wait for like 5 minutes, okay? Add more blood. Okay, add more blood, and you should be able to see clear agglutination, guys. Don't have it hazy, like, is it or is it not? No, it should be or shouldn't be. There is no maybe here, okay? So blood grouping, be careful. Then hemoglobin estimation you can do. Hemoglobin estimation, okay, little subjective, the color, dark, light, that is fine, okay? But blood grouping should be a plus or a minus. There can be no maybe in that, okay? Then what else? When they are giving you a peripheral smear of a patient's blood, you should be able to count the WBCs, the RBCs. I think RBC is not sure. No, you don't need to count RBCs, but you need to count the WBCs and the platelets. You need to know what type of a condition it is. It's a megaloblastic anemia, microcytic hypochromic anemia, right? You should know, you should be able to tell which type of anemia the patient has. They also give you a history. With everything, they give you a history. With the slides, they give you a history. With the hematology slide, they give you a history. So by the patient's history, you'll be able to judge the case. You'll have to just confirm it with the lab diagnosis. Then what else? Charts, guys, they will give you case study. Then you will be able to come to a diagnosis. Let's take a chart and see it. Let's say there is a case study they give you. So here they are giving you CFSF analysis, so many things. What will you think the diagnosis is? So here it will be pyogenic meningitis, acute pyogenic meningitis. Why? Because glucose is less, right? So if there are neutrophils, so a lot of things you will see. The appearance is turbid. The person has fever, right? And they will say neck rigidity. So you know it is meningitis. So basically pathology is not that difficult if you go like this. Gross, 2 points. Microscopy, 2 points. Specific points about each disease. Classifications you should know, like what are the types of ovarian tumors, what are the classification. So specific things, priority things you focus on, it should not be so difficult, okay? But focus and read. If you don't read, it becomes very difficult. So we'll meet you in the next video, guys. Bye.